Yeah, genomic subtyping of bladder cancer has received a lot of attention in the last 5 or 6 years. It's a concept that's well known, for example, in bladder cancer, in breast cancer rather, has been well known for a couple of decades and was relatively new to bladder cancer. And it certainly provides a nice framework for studying the molecular biology of bladder cancer. I don't think anyone would debate that too much. But the question really is it clinically applicable? And there are various reports that pick out different points of subtyping, and it does look like it may have value in some scenarios, but we don't have enough validation to really use it currently. Some of the key findings are, for example, the basal subtype. So I should back up maybe a minute and say when we're talking about genomic subtyping, we're talking about RNA-based classification. And the big divide would be into luminal and basal, and then there are different classification systems that subdivide those groups and maybe add in groups. For example, there are some tumors that are neuroendocrine-like based on gene expression, even though they're morphologically regular urothelial carcinoma. So there are various bits and pieces we can pick out. It looks, for example, like the basal subtype has a poor prognosis without chemotherapy, but the biggest benefit from neoadjuvant chemotherapy, so the biggest improvement in survival with neoadjuvant chemotherapy. I think that's one key question that we need to verify in prospective trials. The luminal papillary patients tend to do very well with or without chemotherapy. Doesn't necessarily mean they're resistant to chemotherapy, just means that they do well even without it. And so maybe they don't need it. We need to sort that out. There's evidence from some studies that Yair Lotan has led from Dallas that patients with luminal papillary tumors are least likely to be upstaged between TURBT and radical cystectomy, again implying that maybe surgery is all that they need. We can also use it in different settings. There's the group at Mass General in Boston has looked at subtyping in the context of response to radiation. They didn't see clear differences between the subtypes, but they did see that an inflamed RNA signature, so implying immune inflammation, that those patients responded, that stratified a cohort of patients treated with radiation, even though it did not necessarily stratify patients undergoing surgery. So there may be some differential benefit there. So I think there's a lot of preliminary information that we need to evaluate in further trials. There is a trial concept percolating through the system through SWOG that Josh Meeks is leading with Seth Lerner. And hopefully we will be able to get a prospective randomized trial going where we use subtyping to make decisions and then validate whether it is important or not.